Hi friends, welcome back to another YouTube video. My name's Dr. Qureshi, aka The Mind Doc, and for those of you who are new to the channel, I'm a registered psychiatrist in the United Kingdom. Today I'm going to take a bit of a break from my usual style of video, so this is not going to be a top tips video, rather it's going to be a bit of a reflective post. The topic of discussion today is a very serious issue, and that is the issue of suicide. As a psychiatrist, I interact with suicidal patients on a daily basis. Every single person on planet Earth, without exception, has a breaking point. And if you've been pulled in 6 different directions, you've got an unfulfilling intimate relationship, if you've got family troubles, if you've got stresses at work, if you've got your own physical health issues, if you've had traumas in the past that are coming back to haunt you, if you have a meaningless life without a sense of purpose, then you're being pulled in all these different directions. They can all be factors which contribute to the feelings of wanting to end your life. It's really sad for me to see so many people in the world and people that I interact with on a daily basis that are depressed and anxious and resentful and hopeless and aimless and nihilistic. For me as a psychiatrist, seeing a suicidal patient is simultaneously the worst and the best part of my job. It's the worst part in the sense that there's a lot of uncertainty associated with it. People who are suicidal, they may or may not end up killing themselves, and we have to tolerate that uncertainty. On the plus side, there's nothing more rewarding, nothing more fulfilling and uplifting than walking into a room with a depressed and suicidal patient and coming out of that room with them no longer being suicidal and having that little bit of hope in their life. In this video, I highlight some of my reflections on suicide and what you might be able to say to somebody who's suicidal. And indeed, if you've felt suicidal or are feeling suicidal, just to give you a little bit of hope. The first point that I wanted to make is that if you're feeling suicidal, you're clearly struggling and clearly overwhelmed, but you need to carefully think through the consequences of your action. If you go through with a suicide, how will it affect other people, the loved ones in your life? I've had patients that decades later, after a family member's committed suicide, they're still torturing themselves, feeling immensely guilty, feeling at blame for what has happened. They'll always be wondering, is there something I could have done different? Should I have picked up on these signs? Is there something I could have said to stop my loved one doing this? They'll be constantly beating themselves up for the rest of their lives, and the question you need to ask yourself is that what you want to leave behind? The next point to remember is that death is forever. It's irreversible. You can't change things once you're gone, but you do have the power to change things when you're alive. When you're gone, that choice is over. So now is the time to take back control of your own life. And I know it's not easy. Life is like climbing a mountain, or if you imagine walking up to the top of a tall skyscraper and you can only use the stairs, and hell, you might even have to build the stairs, but you'll get there eventually. You have to take it in small incremental steps and things will get better. As long as you get to the next day feeling 1% better than you were the day before, that's a step in the right direction. Most people who are suicidal don't actually want to die. They just want the pain to stop. And you have to remember that that pain will stop. Those feelings will pass. For example, if you lose a loved one, you often wonder, how am I going to go on with life? How can I manage now? But life does go on and you do recover and the pain does subside. I'd go as far as to say that you've got a moral obligation to keep yourself alive, because society would be a much worse off place without you. I always imagine it as every single person on earth bringing a light to the world, and everyone has that intrinsic value. Whether you see it or not, other people do see it. Everyone has an intrinsic value. If you end up killing yourselves, you extinguish your light from the world, and the world becomes a much darker place. You can't just casually bring your value to an end. You need to think about what your talents and your passions are. Try and bring meaning back to your life. I've seen people who are in the very pits of depression, who are suicidal, about to go and kill themselves, and they turn things around. They find a passion, they reignite a flame. I've seen people who have become charity workers and given back to society and found a sense of purpose from that. I've seen people who start writing and find that they have a talent. They journal and they write about their experiences with depression, and that again gives them that sense of value. The act of trying to figure things out will provide you with that hope. My last point is not to do something final until you've explored all possible options, and I guarantee you, as a psychiatrist, that you've only just begun to explore the tip of the iceberg when it comes to your treatment. There are so many effective treatments for depression and anxiety. Finding the right support group or network, seeing a psychiatrist or a psychologist, trying treatments with antidepressants. There are loads of antidepressants out there. Finding a hobby or an interest that will reinvigorate you. There are so many things that can be done to get you over this. Maybe you haven't revealed to your loved ones the way that you're feeling, but you have to start talking. You owe it to them, and more importantly, you owe it to yourself. If you're feeling suicidal, please seek help from professionals. And if you know someone who's suicidal, please direct them to the correct services. See your local doctor. You can ring 111 or 999. They're not just there for physical health support, they're there for acute distress as well and mental health issues. In the United Kingdom, there's the Samaritans service, which are an excellent service for people who are feeling suicidal and down in the dumps. I'm just going to leave the number down here below. Just remember that there is always hope. If you found this video helpful, please give me a thumbs up down below and subscribe to my channel. Until next time, stay safe.